Hello everyone. This video is on Phaco in a Brown cataract with Intraoperative Floppy Iris syndrome. You can see that the cataract looks very dense, and also the pupil is relatively oval and mid-dilated. So after staining, when I was removing the dye, there was iris billowing, and iris started prolapsing towards the side port. Yeah, this denotes that the iris is quite floppy, and also you can see that the pupil has started coming down. So invariably we need to use pupil expanding devices. I here used iris hooks, 5 of them, to have a better visualization. As we know, in brown cataracts we cannot make a small capsular axis. At least my aim is to make at least 5.5 to 6. One should not be one should not create a capsular axis more than 6, because larger capsular axis, sometimes the nucleus can prolapse out and will make the surgery a little bit difficult. So relative larger capsular axis, at least 5.5 to 6. And next comes the very challenging step, which is the hydro dissection. As the cataract is quite dense, one cannot appreciate the fluid wave, so one has to rely on the nucleus. You can see that the nucleus slightly lifted up. This suggests that there is a complete hydro dissection, pressing so that the fluid will come out. And then you can checking the rotation, nucleus rotating freely. Started my Phaco emulsification. This is my sharp chopper of 1.5 millimeter, and started making a short deep trench. It should be quite deep until one can appreciate mild red glow. And now initiated my chop here with the settings mentioned. My aim is to divide this nucleus at least in 2 heminucleus. Now the 2 heminucleus has created. So each heminucleus will be chopped one by one, at least 8 to 10 pieces of nucleus pie I want to create. Also make sure that the posterior plate is separated. Now the next heminucleus will be chopped now. The central part is quite dense. I'm hoping that the central part is also separated. As I don't want to use too much manipulation, as we know in brown cataract the zonules can also be on the weaker side. Now as the chop is completed, now I will start my quadrant emulsification. Injected dispersive viscoelastics, below which I injected HPMC, which will act like your modified soft cell technique. Now started my quadrant emulsification with the parameters mentioned here. Each pie will be held and emulsified in a safe zone, one by one. So the 2 pieces came out nicely. This is another pie. This is not coming freely. Looks like it is attached at the center. The tip is attached at the center, but can be emulsified. So leave that small tag. Continue with the side pies. The rest of the pieces are separated from each other and came nicely to the Phaco tip. And for the last piece, one should be very careful, because as we know in brown cataract the PC can be quite thin and floppy. So I decided to come out, inject viscoelastic so as to push the posterior capsule behind, and then continued with lower parameters. A small epinucleus bead was there in the antechamber, which I removed it beforehand, because if we don't remove it and start irrigation aspiration, this sometimes the small chip can hide under the iris or somewhere in the angle, and in the postoperative period they can lead to your iritis, chronic iritis, or even CME. So started my bimanual irrigation aspiration. So after that, with the hydrojet polishing the posterior capsule, injecting viscoelastics to form the chamber, and a single piece lens is placed in the capsular bag. You can see that the optic is well covered, going below the IOL to remove the viscoelastics. And that's it, forming the chamber, injecting antibiotic. Thank you for watching.